Global healthcare, the United States versus Sweden. Private health insurance and government health insurance in the United States. Private health insurance, likely to obtain private health insurance through workplace, and it costs $1,152 per family per month. Government health insurance spends $1.2 trillion per year. Medicaid is government-funded healthcare that supports people with a low income. Medicare is government-funded healthcare that supports people with disabilities and is provided by tax dollars. Private health insurance and government health insurance in Sweden. Private health insurance is 4,000 SEK per year, which totals $450 in the United States, and there is no public insurance. Government health insurance is 78.4 billion SEK, about 9 billion in the United States, per year, and it's government funded. Universal for all citizens and financed through taxes and national government. Access to health insurance. In the United States, many get it provided through jobs, and government provided insurance for about 50% of people through Medicare and Medicaid. In Sweden, it is largely tax funded and mainly government funded, but there is an option of having private health insurance. Costs. The United States blood work is free if you're insured and $1,500 if you're uninsured. X-rays range between $260 and $460 if you're insured, and $500 to $1,000 uninsured. Doctor visits are between $25 and $50 insured and $200 to $300 uninsured. In Sweden, blood work is free insured. X-rays are $1,000 to $2,000 SEK, $110 to $220 in the U.S., and doctor visits range between $110 to $220 SEK, which adds up to $10 to $20 in the U.S. Optional versus required. Not required in the United States or Sweden. In Sweden, there is no public insurance and all funded by national government. Coverage is universal, and there is even temporary health insurance for tourists in Sweden. Inpatient and outpatient surgeries. Sweden and the U.S. healthcare options are very similar. In both the U.S. and Sweden, inpatient and outpatient surgeries are available. Also, both have emergency rooms. Services available and rankings. In the United States, healthcare ranked last compared to the other 6 industrialized countries. Hospitals and doctors charge more in the U.S. than in other countries. Prices of drugs and healthcare are decided by the professionals in the field and not by the government. High restrictive practices in the U.S. compared to other countries. These contain racial/ethnic, medical fraud, gender, and hospital errors. Services and available rankings in Sweden. Ranked 3rd overall, there is a high number of doctors, there is above average healthcare spending, a low prescription of drugs, and has 60 hospitals that provide specialist care and 79 hospitals overall. Sweden's healthcare is divided into 7 categories. The first one is close to home, which contain primary health care clinics. There is emergency care, elective care, inpatient care, outpatient care, specialist care, and dental care. And these are references.